Hi, this is Erica Dorr, Associate Director of the North American Thrombosis Forum. I'm here today to speak with Dr. Piazza, NATF Board Member and Education Chair, about Cleveland Cavalier Anderson Varejao and his recent diagnosis of a blood clot in his lower right lung. Thank you, Dr. Piazza, for taking the time to speak with me today.
My pleasure.
Can you give our viewers a brief summary of your background and expertise in the field of venous thromboembolism?
Sure. I'm one of the vascular medicine cardiologists at Brigham and Women's Hospital. I'm also on the board of directors and the education chair for the North American Thrombosis Forum. My clinical practice involves thrombosis in all of its forms, both arterial and venous, but I see many young athletes who have suffered deep vein thrombosis and pulmonary embolism due to sports-related injuries.
What are your initial thoughts on the recent diagnosis of Varejao?
Well, I think that it's something that we see very often clinically. I know that it's a point of interest for the media because the thought is that a professional basketball player who's the center for a good team shouldn't be suffering any medical problems such as venous thrombosis, but we actually know that he had suffered an important sports injury, was diagnosed with a quadriceps injury that required surgery. Lower extremity trauma and injury increased the risk for venous thrombosis, and then if you add on top of that major surgery, the risk increased even further. So Anderson Varejao was exposed to a high risk for venous thromboembolism even though he's young and healthy because of his recent injury and the surgery needed to correct that injury.
There have been a number of athletes who have suffered from DVT and pulmonary embolisms. How is it that such healthy elite players get blood clots?
Well, I think that the important thing is that any young, healthy athlete can suffer deep vein thrombosis or pulmonary embolism in the setting of a major orthopedic injury and as a consequence of the surgery that's performed to repair or fix that injury. Some patients do have genetic predispositions to developing venous thrombosis, and that may play a role. We don't know any of that workup for Anderson Varejao. And the other thing that's important to think about in female athletes is whether they're on birth control pills, because that also can increase the risk synergistically when you combine surgery and an orthopedic injury.
There are a lot of knee injuries that require surgeries in professional sports. Do you think these athletes should be monitored more closely for VTE-like symptoms post-surgery?
Well, I think that's clearly something that's important. I think patients need to be told about the signs and symptoms of venous thrombosis, and clinicians who care for patients with knee injuries and other orthopedic injuries need to be aware of the clinical presentation of venous thrombosis. The guidelines themselves don't endorse much more than that for simple orthopedic injuries. There are many recommendations about prophylactic measures to be taken in patients who undergo surgery for orthopedic injuries, especially if those require joint replacements.
Is there anything else that you wanted to address concerning this injury or any input that you had?
I think that this is just a good reminder for all of us that venous thrombosis can happen to young, healthy patients, and that we need to, as providers and as patients ourselves, recognize orthopedic injury and surgery to fix orthopedic injuries as high-risk periods for venous thrombosis.
Great. Well, thank you again for taking the time to speak with me. I hope our viewers enjoy this video and learn a little bit about athletes and diagnosis of blood clots.
Great, thank you.